At UCB, we believe that healthcare should be based on one simple idea. How can we all work together to create value for our patients?
The global healthcare system has a colossal waste problem. To address this problem, all stakeholders will need to work together to ensure that patients get the best possible healthcare for the best possible value. Founded in 1928 and based in Brussels, UCB has operations in 40 countries, focusing on neurology and immunology. In committing to the UN Sustainability Development Goals, UCB is helping to reduce waste across the entire industry by calling all stakeholders to collaborate in maximising value for patients around the world.
It is estimated that a fifth of all healthcare spending worldwide is actually wasted. That is $1 trillion. And imagine what we could do with $1 additional trillion worth of healthcare. Now, this waste comes in many forms. It is all about medications which are not used, treatments not taken, appointments not adhered to, or data which is available but not shared between doctors. This level of waste is intolerable. It's unsustainable. We think many times of waste as a systemic problem affecting organizations. That's wrong. Waste affects patients too. It affects when they get their treatment. It affects the cost of the treatment and the success of the treatment. 80% of the healthcare outcomes are driven by social environmental factors, such as quality of the education, the condition of the housing, or the level of income. This is what we call social determinants of health. In the US, only 12% of healthcare investment go to these social determinants of health, which means that the vast majority of healthcare spend goes to diseases which in many cases could be prevented. Now, of course, people will get sick and they need to get treated. What we need to do as healthcare stakeholders is understand what truly drives a healthcare outcome and invest in that so that we can reduce costs to society and make actually healthcare more sustainable. 25% of patient medical data in the US is held in federal and state electronic medical record. So you think a gold mine of data. Just imagine the insight we could gain by looking on a population level how people take and react to their treatment. Today we do not have access to the insight because the data is stored in a myriad of systems, structures with very complicated policy restrictions and technology consideration. Strong partnerships are those which are focused on improving the outcomes for patients in their communities. A great example of such a strong partnership is Project Eden, launched by the largest public-private partnership in the world, IMI. It aims to harmonize 100 million anonymized patient medical records and put it in one common data source.
The healthcare sustainability problem is a simmering threat that as a society we can no longer ignore. Radical change is needed if we are to rise to the challenge.
Building a sustainable healthcare ecosystem is going to be a long journey. It's going to happen step by step. But what we are saying is, let's take this first step. Let's break the silos and unite on patient value.